There you are. Hello. Hi, Howard. Off you go.
How you doing, Chris? Good stuff. And good morning, everyone. So my name's Hal Gray, and I lead CGI's sustainability and climate change advisory team. So a team of experts from a broad range of disciplines across sustainability, energy management, behaviour change, essentially working with our clients across the public and private sector in helping them deliver pathways to net zero. And as part of that, we have a number of engagements completed, but also ongoing with NHS trusts and ICSs around their own net zero ambitions. So really just today wanted to talk very briefly about what's going on in and around the NHS in relation to net zero, some ambitious targets, and some new challenges ahead, particularly for SMEs and NHS supply chain. Let me just share. Okay, so when we're working with clients, we work against a four-step process, and sustainability is it's riddled with jargon, it's riddled with acronyms, as you see in front of you there. But essentially what we do is work on a four-step process. We start at the top left-hand side with clients, and that's typically clients who are relatively immature or just starting out on their journey. So we help organizations assess where they want to go. Is that net zero? Is that carbon neutral on the way to net zero? When do they want to get there? And what are the things that are the most important to them? And within the NHS, a lot of this has been defined with, as we'll talk about very briefly, net zero 2040 and net zero 2045. We then move across to the plan, which is probably where a lot of organisations within the NHS currently are. So they know where they have to go, they know where they are today, but it's really a case of that roadmap and how they're going to join the dots to get to net zero. Dropped down into perform, which is then all about disclosure, benchmarking, demonstrating you're making progress. And that can be done by NHS trusts, ICSs, through green plans, updates to green plans, but also more broadly, the NHS publishing its progress as well. And the final part is sustain. So what role can technology optimization play within accelerating that journey to net zero? Just really wanted to very briefly talk about some context to climate crisis. It's very difficult to open a newspaper or look at an article online without seeing that in terms of climate crisis and in terms of the looming climate crisis, that we're not moving fast enough, we're not moving quick enough, and we're not doing enough. I think that often can be overwhelming for those working within sustainability, in particular those working within sustainability within the NHS. The middle image is something I recognise being a child of the 1980s. And it's fascinating that 40 years ago, we were using electric vehicles to deliver product in recyclable bottles. But nevertheless, we used electric vehicles back in the 1980s because, yes, they were quiet for morning doorstep deliveries, but also because we had relatively cheap electricity. And we burnt coal. We burnt an awful lot of coal. We burnt coal because it was available, and lots of people are employed in the coal industry. We didn't use electric vehicles at that point because of the looming climate crisis. And just as an indication then, 40 years ago, so roughly 1983, roughly 85% of the UK's energy mix was coming from burning coal. The last 6 days, the amount of coal we burnt in the UK, nothing. So even though it can be overwhelming in terms of climate crisis, we are making progress and we are moving forward. And I think the important message here for anybody involved in sustainability, and particularly the NHS, is it's important we are engaging on sustainability. We don't need to solve the big problems. What we need to do is focus on how we can continue to move the needle when it comes to NHS trusts, ICSs, and those working in and around that. So in terms of NHS England, way back in 2008, the NHS created their Sustainable Development Unit. But the key moment was in October 2020 when the greener NHS vision was announced. And that is, you can see in front of you, world's first net zero health service and to respond to climate change. And two targets were set. The first of these was net zero by 2040 for the emissions the NHS can control directly. And the second, more ambitious and fairly interesting, was by 2045 for those we can influence. And essentially the difference between the two is reaching down into scope 3. So, scope 1, scope 2 is all about getting your own house in order, understanding your buildings, understanding how your people will move around, understanding your operations. Scope 3 is digging further into upstream, downstream emissions, and importantly for the NHS, also thinking about how their patients, their suppliers travel to receive care, travel to support their operations. And as an indication, again, you see on the right from Sir Simon Stevens, roughly 4% of the nation's carbon emissions. To put that into context, global healthcare is estimated around 4.4% of global emissions. So what you see in front of you is how the NHS very clearly have split their emissions, scope 1 and scope 2 that I've mentioned, which is NHS carbon footprint, with some limited scope 3. And then more broadly on the right-hand side, so 5 years later, really digging into supply chains, understanding patient and visitor travel, and ICT within that as well. Just to put that into context, the UK's emissions in 2019 were measured about, for NHS England, measured about 25 megatons CO2 equivalent. It's an awful lot. It's roughly the total emissions of Sri Lanka as a country. So just to put that into context, but also on the positive side, there's been circa 25% reduction from 1990 levels. So everything moving in the right direction. And on the right-hand side, you see again the NHS carbon footprint, so building energy, gases, business travel, fleet, water, waste, but you see the contribution, the size of the contribution for effectively supply chain, medical equipment, medicines, chemicals, ICT, everything that we do as our businesses as well. There's been a relatively large amount of support for NHS trusts and ICSs. Every trust and ICS from June 21 was guided towards producing a green plan to ensure that every board member is responsible for the net zero targets in each trust ICSs, and they were producing a green plan. And the aim was, first and foremost, that by 14th of January last year, trusts should finalise and submit these up to their ICSs, and then each ICS subsequently, a couple of months later, to consolidate a system-wide green plan. So there's been plenty of guidance, but nevertheless, it's still a fairly daunting, or was a fairly daunting prospect. And having seen a number of green plans for trusts and ICSs, then there's a real variety in terms of depth, in terms of quality, and how far they go in addressing roadmaps. So very good at assessing where they are today, but actually, how can you translate, and how difficult it is for some of those within the NHS to translate that to actually a roadmap that has credible and measurable and reportable actions on it. Majority, I believe, completed their green plans as at trust level and consolidated at ICSs, but there's a real difference in terms of content, quality and scope of those. Very conscious I've talked about primarily NHS England, and I guess that's where the clearest guidance has been, but also wanted to acknowledge other efforts across NHS Wales. We see there, so alignment to Wales as a national entity focusing on 2030, and also in Scotland. Previously, the guidance was before 2045, it's now 2040. And again, latest reporting and information is available from all of the devolved parts of the NHS, or all of the NHS bodies that come together. On the bottom, health and social care in Northern Ireland, the last guidance I saw was aligning to UK government's target of 2050. And we have to bear in mind here that the ambition shown, or being shown by the NHS for 2040 and 2045 falls in line and within, and in terms of 2040, for both Scotland and the UK, and particularly for Wales, aggressively within that 2050 UK PLC net zero. Interestingly, whilst we have NHS England net zero by 2040, and Scotland, as I mentioned, and Wales, NHS Digital are aligning to government's 2050. But in front of you there, again, information available talking about themselves becoming a net zero organisation and providing leadership in terms of sustainable digital services. So everything from clouds, cloud hosting arrangements, and supporting their staff to take action on net zero. And again, relatively short time today, but I think sharing this presentation afterwards, there's links there to the latest sustainability report from NHS Digital. But again, NHS Digital 2050, NHS England as you know, the one we're talking about, then 2040. So a bit of a difference there. In terms of challenges for net zero for trusts and ICSs, the NHS is filled with very strong professionals in terms of estates and estate management. The difference here is it's a new challenge. We're instead of looking at year-on-year incremental improvements, saving money, driving energy reduction down, driving energy costs and reduction in energy, we're actually now asking to focus on a net zero roadmap. So not just doing better than we did last year for those estates professionals, but actually how do we translate that towards a goal of net zero? Internal resource and priorities is also a challenge for the NHS. So we spoke to a lot of NHS professionals. We talk to a lot of sustainability managers who quite honestly are swamped. Anything related to sustainability gets pointed in their direction. And it's very easy for things to be reprioritized, as you would expect, with a focus on frontline care within the NHS. What we would always advocate within NHS trusts is forming executive leadership as highlighted within the Green Plan requirements, but also the correct structure within organizations to support a head of sustainability, a sustainability director or a sustainability manager. We always talk about, when we're talking to clients, sustainability is not one person's job. It needs to be part of everybody's job. So a lot of the work we do with NHS trusts is helping behavior change, helping them form the groups, the networks that they need to support delivery of net zero. Also, there's some confusion sometimes in terms of understanding the role NHS property, supply chain, and as we've seen, NHS Digital were playing delivering a net zero NHS. And finally, national guidance. So inhalers, metered dose inhalers is very much drawn into net zero, but actually there needs to be a UK-wide approach, and guidance, although available now, was fairly slow. So NHS professionals or sustainability professionals working with the NHS looking for actually what do I need to take responsibility for and what am I going to get guidance from in terms of property, building, supply chain. And just very quickly to give an example here, some of the work we've done, we work with University Hospitals Plymouth, helping them with their data governance, but effectively giving them the confidence in the processes and giving them the opportunity to the information they needed, the confidence in the processes they were undertaking for them to self-deliver going forward. And there's often a perception with consultancy, certainly, that organizations come in, they embed themselves and they're there and you can never get rid of them. What we focus on is delivering short, sharp pieces that really aim to help NHS Trust drive forward, but also give them and empower them to deliver for themselves as well. Final part, Chris, because I can see you've appeared on my screen, probably to hurry me up a tiny bit.
Good, thanks.
But in terms of that next step and reaching down into supply chains, in front of you again, you see our own plan. So CGI in the UK, net zero by 2026. We've kind of got our own house in order. We know what's happening in our offices. We know how people are moving around. If you look on the third box, what we're now doing is digging down into our supply chain. So we're looking at the products, the services we buy, and asking more of our suppliers to help align with us on our net zero journey. At the moment, this is very much a collaborative piece. So we're helping organizations within our supply chain come on that journey with us. At some stage, as we get nearer to full year 26 and our desire to be net zero, we will make procurement decisions based on whether our whether our suppliers have carbon reduction plans. And why am I mentioning this? Well, CGI as a business from September 2021, and I'm sure many on the call will also be have clear of this. So government guidance, anything over 5 million. So we do a lot of contracts around about that level. So for us, it's important we have to have a carbon reduction plan to be able to bid for contracts over 5 million and have done so since September 2021. Why is that important? Well, actually, the latest news from NHS and Net Zero is from April, from now, 2023, NHS England have adopted the government's 5 million threshold and needing a carbon reduction plan. So if you supply into the NHS, contracts above 5 million per annum, you need to have a carbon reduction plan. The key part of this is from April of next year, all procurement will have to have a carbon reduction plan. And just to put that into context, NHS supply chains estimated about £30 billion per annum of spend. That's about 80,000 suppliers. So although we've got kind of time to understand the approach and how that's going to work, a supplier of any size, so not just across the 5 million threshold, but a supplier of any size in a year's time will have to have a carbon reduction commitment, in theory, to continue to supply into the NHS. So 80,000, both large, medium, but also SMEs in terms of supplying into the NHS. That's everything for me. Very conscious of time. It's a very quick skip through NHS in terms of net zero targets, plans. With supply, I think the presentation afterwards, please see in front of you also a QR code for CGI's Healthcare Club. Thank you, Chris.